Okay, so in this video, we're going to be talking about treatment of subjects. There are two ways to categorize data according to its source. There is primary data and secondary data. Primary data are data that collect directly, okay? So sources of this type of data include the following. You can have experiments, survey instruments, or observation instruments. When collecting primary data, most researchers run what's called a pilot study first. This is a small-scale version of the research plan, and an example of this is kind of like a TV show. Whenever a TV show is first started, usually you know how they have, if you go to Netflix, it'll say pilot episode for the very first, like season 1, episode 1. And the reason for that is because before it becomes a TV show, the creators will create the first episode, and then they'll take that to a publisher, either like NBC or Fox or some other TV channel, and they'll say, "Hey, we have this show," and then from there, the Fox or NBC or whoever it is might say, "Yeah, that's good," and then they'll turn it into an episode or turn it into a TV show. So a pilot study is done first, and now secondary data is data that have been collected by someone else and are available to the researcher. Some examples of this include the internet, such as websites like U.S. Census Bureau and other government sites, printed materials like books, almanacs, newspapers, and magazines, and historical documents. Now, just be careful when you're using secondary data as a part of your research. You must ensure that the data is reliable. When collecting primary data, you're responsible for doing everything possible to ensure that the participants are well informed and safe. Now it says the National Commission for the Protection of Human Subjects and of Biomedical and Behavioral Research was created by the 1974 enactment of the National Research Act. Its purpose is to identify the basic ethical principles that should underlie the conduct of biomedical and behavioral research involving human subjects, and to develop guidelines which should be followed to assure that such research is conducted in accordance with these principles. The Commission developed the following guidelines. Part A says ethical principles and guidelines for research involving human subjects. Part B, boundaries between practice and research. And then part C and D have a little bit of extra. It says C is basic ethical principles, respect for persons, beneficence, and justice. And applications is informed consent, assessment of risk and benefits, and selection of subjects. The issue related to these guidelines include the protection of vulnerable subjects, recruiting volunteers, payment for volunteers, and so on. To ensure that researchers follow these guidelines, research facilities have institutional review boards, or IRBs, that must approve all study design plans. If a facility does not have its own IRB, it must contract with an outside source. So the U.S. Department of Health and Human Services Food and Drug Administration performs inspections of IRBs to ensure that they are working effectively. You will explore these guidelines further through a class share activity. Discuss the following questions and record your responses. Question 1 says, describe why special classes of human subjects need special protection. Select your choices from the following list. Fetuses, women, children, and minors, cognitively impaired persons, prisoners, traumatized or comatose patients, terminally ill patients, elderly or aged persons, minorities, students, or employees. So it's basically asking us, why should we make sure that these classes of people, or these groups of people, have special protection? And so the reason might be because protection against identity theft, HIPAA violations, and accessibility to people who don't want their identity revealed. So we can just say protection against identity theft, HIPAA violations, and accessibility to people who don't want their identity revealed. Okay. Now, question 2 says, could excluding classes of people from research studies be dangerous? So if you exclude people such as anybody from this list, from question 1, anybody right here, or any other groups of people, you could be, you may not ever learn about it, and you could possibly negatively affect the study that you're doing. So if you are trying to figure out if a certain medicine works for a group of people, if you exclude children from that, you might not be able to see the side effects or the positive or negative side effects of a child taking this medicine. So we can say if a class is excluded, we may never know about it or never learn about it. And an example of this is excluding children from medical research. Okay. Now, question 3 says, how could a survey or questionnaire be dangerous to participants? Well, if you're talking about sensitive questions, then that you're asking these people to answer, that is fairly confidential. If that stuff is breached, they could possibly suffer from that. You know, if you're asking about what's your social security number, or are you married? Are you pregnant? Do you have children? What is your maiden name? Things like that, that ties into other very important things such as like bank accounts, income, things like that. And that information is breached or stolen, it could possibly hurt that person. So we could say if there are sensitive questions being asked, and the information is breached, these people could suffer. Question 4 says, why is informed consent of human subjects important to a research? So if you don't have their consent, you could be giving out information that they don't want out there. They just need to know the purpose of the subject or the research and what information they're giving up. So we can say they must make sure their subjects know the purpose procedure, length of time for the study, whether or not placebos will be used as well. And researchers don't want legal issues based on an investigation. So, like we said, if they are unaware of what this research is for, they could come back and say, hey, I didn't know you were using my information to do this. And so that could have a lawsuit on their hands just based off of that. So we can say researchers don't want lawsuits based on an investigation. And now number 5, it says, what factors should a researcher consider in deciding whether to pay volunteers to participate in a study? Now, it is legal to pay for volunteers for research participation, and it's especially common when there are very few or no health benefits. Now, the amount must be decided in advance. So if you say you are going to get 100 people to try and test a mattress, that you're a mattress company, you want people to test this new mattress that you're coming out with. If you go up to people and say, hey, I'll pay you to use my mattress, use this mattress in your house for the next month every night. And if you don't know how much you're going to be paying them in advance, then it's going to be kind of awkward trying to say, oh, well, I guess I could pay you X amount. You need to tell them, hey, I will pay you this much money for 1 month of research. So we can say it is legal to pay volunteers for research participation. Now we can say it is especially common when there are very few or no health benefits. And now the amount must be decided in advance and shouldn't be large enough to influence someone to participate. Going back to the mattress example, you don't want to pay someone $1,000 a night to use it for a month. Even if you have the money to be able to do that, if they come out of that research study saying, oh, it's the best mattress I've ever had, you have to ask yourself, did they say that because it was actually that good of a mattress? Or did they say that because they were paid $1,000 a night to sleep on it? So you want to pay them enough to compensate them for their troubles, but not so much to influence their final answer.